record here. All right, we'll start with some introductions here of our team so that you know who's in the room. And again, if you're just joining us, please put your name and your organization, your location in the chat so we know who's with us in the room. Hello, everybody. My name is Kevin Bailey. I'm the Idaho Nonprofit Center CEO. Really happy to have you all here with us today. We've got a couple members of our team on the call as well. I'll let them introduce themselves. Let's start with Evan, then Sam, and then Dave.
Hello, everybody. Evan Bask. I'm the COO and Head of Development here at the Idaho Nonprofit Center. Good morning.
Good morning, everybody. I'm Sam. I'm the Communication and Engagement Coordinator at the Idaho Nonprofit Center. And good morning. Happy to be here with y'all.
Great. Hi, I'm Dave Knope. I'm the health insurance broker that is working with the Idaho Nonprofit Center on this health insurance initiative.
Awesome. And Dave, so Sam and Evan are in Boise, so am I. And Dave, you are located this morning where?
Ketchum.
All right. Is it below freezing yet?
It gets there. I was in Stanley the other morning. It was pretty darn cold.
I bet. All right. Well, as we get started here, the kind of purpose of today's session is really to kind of officially launch this health plan, but also to answer questions that you all have, to get some basic information out on what this plan entails, what it involves. And I'm just going to talk briefly kind of on our goals and where this came from so you have the context. So I've been in the role for 2 years. Certainly before my 2 years, health coverage has been an issue and top of mind for nonprofits and nonprofit leaders for a number of years. And as I came into the role over 2 years ago, you know, we are always asking our members across the state. We have about 850 nonprofit members now. You know, what are some of the needs that they need in order to attract and retain talent and grow their staff? And of course, health benefits was always at the top of the list. We know that there's a lot of nonprofits that still don't offer health benefits because of cost, because of the difficulty with that. We also know that nonprofits as a sector, our greatest asset is our employees and our talent, and how we take care of those employees, whether that's salaries and benefits or other ways. So this is certainly top of mind for us as we were thinking, you know, as a team, how do we serve this need? It's a super complicated field to be in. Healthcare is not my background, so I didn't go into this with any visions of grandeur around what this might look like or even how easy or feasible this would be. But we're lucky to work with experts like Dave, work with people who really know this field, and then it can be an extension of our member benefits that we're able to offer. So that's kind of where this conversation came from, and you know, really clearly listening to our members and clearly hearing that need that having more options for healthcare for our employees, for your employees, was top of mind. And then, so as we got started with developing this plan, and we'll get into some of those details and what this all entails, we really had 4 kind of basic goals in mind, and I just want to list those really quick so you all are aware and familiar with those. Really, the first one was to get health insurance in the hands of nonprofits that don't have access to healthcare currently, and don't have that as part of their benefit package. The second was to really increase workforce retention by prioritizing employee health and long-term well-being. The third was to leverage our collective network. So as a member, you know, this association model health plan to help keep rates competitive year over year and to kind of have that rate stability. I know a lot of us have dealt with over the last handful of years rate jumps as high as 15-20% in some cases, and that just becomes really tough to deal with year to year and not quite sustainable, as you all know. And then lastly, to really empower nonprofits to have more choice in their healthcare options. So while this plan isn't necessarily going to be the right plan for every single nonprofit in the state, it will provide more choice. It will allow you to sort of compare prior plans or you know, the plans that you have out there on the marketplace with your current broker perhaps, and really explore this plan as another option. And in many cases it will be something that can save your organization money. In some cases it won't be, depending on your unique situation. So I just want to lead with that this will not be a silver bullet for everybody. want to set expectations appropriately here. This will be, we'll add to the choice portfolio that's out there, but won't be the right plan for everybody as well. It just adds to those options that we all have. So with that, I'm going to ask Sam from our team to go through some talking points here, and I'm going to navigate to our website so that you all can find these resources for yourself. And then we'll ask Dave to provide a few more details as the plan broker and what that entails. And then we'll have time for questions and answers among the audience. So Sam, I'll turn it over to you here.
Thanks, Kevin. I appreciate it. Yeah, so basically we want to get you guys from, this point to figure out whether or not this is the right coverage for you. So there's a few steps that we have for you in the meantime. The minute you know that you're interested, that you think you'll be interested, that you want to, double check this quote for your organization, you can go ahead and email Dave. We will share that email address with you and some other links and everything as well. But so you'll email Dave, you'll let him know, hey, really interested, love to know what happens next. So Dave will send over some information, some, materials that you can review, kind of just some more information about the plans and their intricacies there. And Dave will also send over a form that's called a personal health questionnaire. So that form will be for all of your individual employees to fill out, all the ones who want to be covered under this plan, that is. And it will kind of just provide, a snapshot of the health information that the underwriter, that the insurance quoter can use to give you guys the best possible quote based on, your actual needs and what your staff really needs in the moment. So once you send off that questionnaire, you will receive from, facilitated through Dave and our partner, our insurance agency partner is called HCS. So you'll hear from HCS and Dave with some coverage options, and then they will basically have quotes, rates, benefits, everything that you would want to, double check on. And then you'll have a chance to talk to Dave, just to, ask any final questions, talk to your team, make sure everything works for you. And then you'll be able to enroll and get all that launched and going. So January 1st is the first day that that coverage begins, but we definitely recommend getting signed up, before that, because it's going to be kind of a tight crunch with the holiday season. So as soon as you guys can express your interest and get that information out, the better. And so we'll talk a little bit more about the intricacies of that process, but if y'all want to review this website page as well, it'll be under the membership tab and then INC health plan. And that will, there's some, that checklist I just went through. You can email that, there's Dave's email right there, and then some FAQs. So the FAQs will be what we're covering a little bit during this webinar, but then there also will be some information there that you can double check if you'd like. So I will go ahead and hand it off to Dave. I am going to pass out this link to double check if your provider is covered under the health insurance plan. The network that we're using is called Cigna Network, the PPO plan. And so I will go ahead and drop this link in the chat. But you can also view it on the website under the question called, what network does this plan use? Are my doctors and providers covered? And you can just click right there. So thanks, y'all. I will pass this on, but Dave, take it away. Let us know.
Yeah. Thanks, Sam. Dave, before you, I'll just briefly highlight this tool. So again, on our FAQ, there's the search tool as part of the Cigna network. You can search by doctor name, by healthcare facility, by specialty area, and then that'll pull up, because that'll be a question that employees will have, is their primary care provider in this network? From our basic understanding, most, if not, Dave, you can comment further on this, for example, for us in the Boise area, you're going to find all those major providers that you're normally used to finding in these networks. Cigna's a big network net in terms of coverage, so you're going to find a lot of what you would expect to find in the search tool. So with that, Dave, I'll let you kind of expound on this further here, and let me know if you need me to navigate through various parts of the web here. So.
Sure. Thanks, Kevin. Thanks, Sam. So first of all, my email contact is the same as you would reach out to Kevin or Sam, dknope@idahononprofits.org. We wanted to make it seamless that way in terms of your inquiry. I'm currently working through a few processes right now with Health Cooperative Strategies, the claim administrator that's using the Cigna network, to make sure that we've just got the right processes in place. And yet, as of, my gosh, yesterday, I have already had a handful of emails of people saying, tell us more. So great to see the interest. Typically, the process is about a 72-hour turnaround. I apologize this week. I'm actually slowing it down this week just to make sure that our processes are in place. Secure health information, that sort of thing. Want to make sure that's completely locked down, and I'm testing that. So in regards to the options and what's available to Idaho Nonprofit Center members, there are 8 different plan designs that you can choose from. So when you reach out and I reach back, I'm going to share with you that menu in terms of we have deductibles that range anywhere from $1,500 to $7,500 deductibles. It's a traditional PPO that you're probably familiar with in terms of there's an in-network deductible, there's in-network coinsurance and plan design, copays, what have you. Excuse me, then out of network in terms of you're not at a participating provider. Speaking of providers, we worked diligently with Idaho Nonprofit to make sure that it's a solid network. If you're in Idaho Falls, if you're in the Wood River Valley, where I am, and I actually got a fair amount of outreach yesterday from some Wood River Valley nonprofits, and I get it. To Boise, for example, in Boise, is St. Luke's and St. Al's in the network? Yes. Is your doctor? You'll want to go online with the link that Sam mentioned in terms of, is my doctor on the Cigna network? Pretty good chance the doctor is. Pharmacies are typically going to be the type of pharmacy chains you see around town. Big national network pharmacy coupled with Cigna. So we want to offer choice. In terms of the process, to get to competitive rates, to make this something that is more affordable than what might currently be available in the local marketplace, there is, honestly, a bit of a process or a hoop jump, paperwork. I'm just being candid about it. They want a private health questionnaire, terms of health histories for every member that enrolls. So if it's just a single employee enrolling, great. Speaking of which, we can handle groups of 1. I've already had that question. Yes, we can do a group of 1. If you're a group of 10 or 20, and you're also electing, say, family coverage, you'll need a private health questionnaire for each family member as well. So I know it's paperwork, people asking you questions. You're like, really? But what happens internally is that's reviewed and put into silos or rate tiers that have already been established. This is a national organization, so that's what's going on behind the scenes. In terms of HSA plans, or if you want to add an HSA account administration to your medical plan operation, you can do that separately. There's lots of HSA administrators out there, including quite possibly your bank or credit union. We're going to offer e-benefits administrators out of Boise. Know those folks. They've got a great shop there, and they'll also process your COBRA, I believe, at no charge. If there is dental or vision, we're in the process, in the works with two options. One is Emeritus for vision and dental. They've got a good statewide network for Idaho as well as nationally. Solid company, been around a long time, great rep here in Boise. In addition to dental, Delta Dental, which you all know, largest dental provider in Idaho. So you've got a couple of options there. So when you reach out, just to summarize, I'm going to send some information back for you to fill it out. I get it. It gets processed to Health Cooperative Strategies. You get a quote typically within 72 hours. Again, this week, I'm purposely slowing it down a little bit to make sure that we get it right. So, Kevin, I think I covered the basics. There's always with insurance and employee benefits, you can go chapters into the night. So happy to answer questions if people have got them, and or anything else that Sam or Kevin is top of mind.
Yeah, thanks, Dave. And I think the one difference that you will notice, as Dave mentioned, just to underscore this point, because we were going through it too as we're enrolling our employees, is that personal health questionnaire. We haven't had to do that when we've gone out to kind of our previous broker in the marketplace. So that's going to feel a little bit different. It might feel a little bit intrusive, perhaps, but kind of getting in front of that with your employees, I think, will be important. Again, that information goes into a HIPAA compliant portal to the underwriter. It doesn't go to us, it doesn't go to Dave. So that information is secure, but that will feel a little bit more detailed than maybe you've been used to in the past. And then the idea with that, I think, is really to get you the most competitive rate that's possible. And again, for some populations, it may not come back as better than you're currently getting, but you'll have, just because you've completed that, and Dave, correct me if I'm wrong, once you've completed that, you could continue to opt back into your old provider as well. You'll just have options in front of you to compare, essentially. Is that correct, Dave?
Yeah.
Okay.
Saw a question come up. It was a good question.
So I'll play a moderator here. Can we enroll part-time employees?
Yeah. So you as the employer, you have W-2 employees. That's your relationship with them. You need to have a consistent eligibility policy for all of your employees. So who you want to enroll on benefits is up to you. So if they're part-time, I don't know, working 15, 20 hours a week, just for example, you decide that they're an eligible employee, great. You just have to keep that uniform for the next part-timer that comes along and says, I want benefits too. you would need to provide that to them as well. So again, a uniform eligibility policy to guard against discrimination.
Got it. Next question was, this organization's based in Idaho, but they have staff in other states as well. Are they still eligible for the employees outside of Idaho?
Yes, it's a national organization. The TPA that we're working with, again, they've got associations and groups all over the country. It's one of actually the attributes in selecting them, and that we're using a national platform, a national organization. We're buying into a big pool, if you will, with a national network. So you may have family members in Oregon or employees, like, I don't know, Ontario, Oregon, or in Washington, and the answer is yes.
Yeah, you'll just want to use that network tool to see which providers are available for those employees in your other locations. That link, we can repost that link in the chat. The next question, there's, I guess, two forums to submit questions. There's the chat, there's also a Q&A function, or you can come off mute. The next question kind of speaks to what Dave was just saying. The question is, what is the advantage of this insurance over just my nonprofit applying on their own? Will rates be lower because we are applying as a group of nonprofits versus as an individual nonprofit?
Yeah, let me elaborate on that. Kevin, you said it well on the intro, and that although we think this is going to be competitive and give you an advantage, our biggest goal here with the Idaho Nonprofit Center is to offer choice to everyone, to give you that freedom of, well, this plan that we're offering is not as good as what I currently have. Okay, we presented an option, we gave you a choice, and it wasn't your choice. On the other hand, we do think it's going to be competitive, and that people will enjoy it. You just have to go through the process to find out.
Thanks, Dave. Next question is, how does the original enrollment for a new group work when you have different start dates or the renewal dates are different? So, for example, can you get a 3-month or 6-month plan in the interim?
Yeah. So, lots of scenarios going to happen. Happen to know of a nonprofit here in the Wood River Valley whose anniversary is November, and this plan is effective January 1. They may enroll or renew with their existing plan and get a better rate and cancel the other plan to join this one. We're also going to be marketing this year round. A group may be interested in March or April or July and want what is referred to as a short contract that trues up for the next January 1 anniversary. We can do that as well, or we can make it, if you sign up in March and you want a 12-month contract and go 12 months out from March, we could do that as well. In terms of rates, although the benefit designs are standard, there's going to be 8 options. Every group is going to be underwritten individually. So group A's rate here in Ketchum may be a different premium rate than group in Boise. Everybody has different rates and different benefits, so it allows you to customize things, and you're rated accordingly.
Thanks, Dave. I think I can answer the next question. Spouses eligibility to enroll. The answer is yes from this plan's perspective, although your own organization will have its own employee benefit policies. So yes, as long as your organization has that as part of their benefit policy. Is that correct, Dave? Spouses and dependents are eligible in this network. But again, depends on, each of you in your own organizations have policies around how much of the percentage of the premium that you cover for employees versus dependents. I know for us, that's an annual conversation in terms of, do we need to adjust the amount, up to which level of premium are we covering? For example, in our previous plan, we cover just the employee premium 100% at the bronze level. And then the employee is responsible for any plan that they choose above that kind of bronze level. So that ends up being a good portion, 75, 80, 90% usually of the full premium for our shop. And that's just our personnel policies, but each of you will have a slightly different ways of handling that. I do want to go back, and just for those who are joined us late, just to recap, I know we had some link confusion here getting on, so I'm going to just show you where you can find some of the basic FAQs. If you go to our website, idahononprofits.org, click on or hover on the membership tab, you'll see the INC health plan in the drop down. And then there's, Sam had covered this earlier, but there's a little checklist of sort of your process in terms of getting in touch with Dave, the plan broker, getting a link, which won't be available for at least a few more days, but a link to the personal health questionnaire that will allow you the ability to submit and then get rate quotes back once your employees or their dependents have completed that. And then you'll be able to kind of compare and contrast from there. So there's a whole bunch of FAQs down here. We're constantly updating that as we get questions that we haven't thought of yet. So please holler with more questions as they come. I'm going to go back to the chat here. One says, we only have one FTE. If we offer coverage to that employee and they decline, are we on the hook for any expenses?
Well, I think if I understand the question, you have one employee, you enroll in the group, and the employee goes away. If I understand that question, then there's nobody on the plan, so there's no premium to pay. You only pay for who's on the plan.
So no liability in that case. There's you basically just pay for who's on the plan. Yeah.
Every month you're possibly going to have additions and deletions, new employees or terminated employees.
That premium bill will be similar to how they've experienced that before, in terms of, as people add, they hire somebody, someone leaves the organization, that premium invoice from the insurer will change accordingly month to month, depending on who's enrolled.
Right.
Yeah. Okay. Another question, is a group of 50 too large for this product?
No.
Perfect. Easy answer. Next question, does everyone in our organization need to choose the same plan option?
Let me clarify that. Does everyone within the employer group or the Idaho nonprofit? I'll answer that two ways. So there's 8 different plan designs. For the group specific, you'll want to choose one plan design for that group. Within the Idaho Nonprofit Center, you've got 8 different options.
Got it. And then let's see, are these plans open to all Idaho nonprofits or just members of the Idaho Nonprofit Center? The way the association plan is set up is you have to be a member to access this plan. So if you have questions about that, or Sam, if you want to put the membership page link in the chat, that would be a great resource for folks. It looks like, Teresa, I don't know if we got to your question, but says, see my previous question above. I'm not sure which question that was. I'll try to scan for it, or if you want to read. Okay, here we go. I found it. If my organization decides to enroll or purchase coverage and continues for the initial year and then drops the coverage, will my organization's employees be eligible for COBRA?
Under COBRA, that particular law applies to any terminated employee is eligible for plan benefits that's currently offered to the organization. So if you drop coverage and you have no coverage, then COBRA is not available, as I understand the law. I can double check on that, but I'm pretty darn sure that's the way it works.
Okay. Thanks, Dave. Thanks, Teresa, for being persistent about that question. I got lost in the chat here. If I've missed any others, please let me know. Any other questions? Obviously, you can ask a question anytime after this as well. And we have our FAQ page on our website. But yeah, Dave really is the expert here. So as you're starting to pursue enrollment or wanting to get those rate quotes, he'll be able to answer those questions that come up.
Kevin, I'll add. I had a group up in Spokane call me yesterday, and she said, I'm probably not going to offer health benefits, but I just have a question as to what can I do in terms of offering something to my employees short of health insurance. And I only have about 30 years experience, a lot of gray hair. So I'm happy to answer questions like that. Just not selling anything, just like, well, here's what you can do. Here's something to think about. Happy to do that just for a Idaho Nonprofit Center member.
Yeah, and one thing I'll say too is, some of you may be in a situation where you're offering benefits to your direct employees and only your employees and not the dependents. And in that case, the dependents of your employees are eligible for the Health Place Marketplace through your Health Idaho, which is a different enrollment process, and that opens up, some of the tax credits available. They've updated some of the loopholes with that in terms of making that easier to access. If you do also offer dependent benefit plans, then it gets a little complicated, so I won't go into those details here, but just know that is a really great resource too, especially for dependents who may be looking for coverage. And the income limits on that are pretty generous in terms of qualifying folks for the tax credit to subsidize some of those premiums for your employees' dependents. So that's something we've taken advantage of here at the center, and can be a good option to complement whatever benefit package you have around insurance at your own shop. And Dave, you could point them in the right direction if they have questions about that, getting into the Your Health Idaho portal. Okay.
It looks like we have a few more questions added to the chat.
Perfect.
If an employee's personal insurance renews in November, would the offering of this option in January be a qualifying event to switch insurance?
I knew somebody would stump me. Let me answer it this way. Every insurance contract, whether I'm not familiar with individual contracts, short answer. Long answer, on group health insurance contracts, every contract has a notice for termination. It's kind of two ways. One, the insurance contract will have in there somewhere 30-day, 60-day notice of termination. Additionally, I can tell you that from my experience, insurance companies will cancel you for non-payment of premium. So that's my best answer to that. I don't know what this person's contract looks like, so it's best answer I can give.
Thanks, Dave. Next question. Do benefits offered or changed from what they were? Does something more need to be approved by the board, or is that more of an internal decision? Typically, I'll take a shot at that question. It kind of depends in part on how much oversight your board needs around specificity in some of the employee policies. We typically won't get in. We'll make it a management decision at sort of a CEO level in terms of which healthcare are we pursuing in terms of which plans. But we'll make it a board decision around the question of are we going to offer our employees health insurance. So hopefully that helps answer and clarify. But when it gets into the specific details, we delegate that down to management and pursuing the best available options for the employees, because management is closest to that scenario. But in terms of as an organization, are we offering benefits and making sure that that happens? That's been sort of approved by our board. So hopefully that helps. Next question was, do small businesses affiliated with the Idaho Nonprofit Center qualify for this health insurance? So we have business affiliate members as well. We're not nonprofits, but are small businesses or businesses that provide services. I actually don't know the answer to that question off the top of my head. I'll need to look into, Dave, maybe you do. I don't know if there's any stipulations that would prevent that or if it includes all members. But yeah. I don't know how to answer that quite yet. Dave, do you?
I do, because I had to chase this for another organization in Boise. So this is technically not an association governed by the Idaho Department of Insurance. This is what is called an ERISA plan governed by the U.S. Department of Labor. It functions just like an association plan, but it's called a membership captive. Okay, that's all the technical stuff. What it means is, what I'd like to suggest, Kevin, is if they're an Idaho Nonprofit Center member, that this is a benefit that's available to them. I draw the line on the membership aspect.
Mm-hmm. Okay, that's a pretty clear answer. So I guess as of right now, yes, the answer is yes to that question. That any business affiliate member would be eligible too. So that opens up that avenue as well for you all. Just a quick comment from Will White, who's with Your Health Idaho. Thanks for being here, Will. Will is a great resource if you have questions about the healthcare marketplace in Idaho, the Your Health Idaho Health Exchange marketplace, so and the tax credits associated with that. Christine, is there a typical size of group that would qualify for lower rates? If so, would the group be large enough? I assume she's referring to this group. And maybe Dave, you can shed light on how the buy-in to the larger network works, because you're each rated individually, but you're part of a large pool as well. So it's kind of two things going on at once.
So honest, I mean, candidly, this is designed for small employers under 50 lives. There was a question just a few minutes ago, like, will we maybe 50 lives and larger? Great. There's no restriction there. The whole aspect of employers with less than 50 lives is extremely problematic when it comes to rates, benefits, access to providers. I'm not telling you folks anything you don't already know. So this organization has hundreds of thousands, close to 1 million members nationally, and we're pooling that entire membership nationally to develop rates and benefits and spread the risk that way. So I'll get a little bit of underwriting, but you could have a group of 20 lives and 2 people have significant health events that the claims clearly eclipse any annual premium that you pay. power of joining a pool is that you're not experience rated or shown the door, if you will, on renewal, because you're deemed a bad risk. So that's the power of numbers, if you will, with this particular organization.
All right, thank you, Dave. Seeing if there's any other questions here. Feel free to come off mute or drop any other questions in the chat or the Q&A function. We'll give this a minute here to let folks act on that. And if there aren't any more questions, we'll kind of sign off from here, but give it another 30 seconds or so. All right, Dave, any final thoughts as we sign off here?
I'm actually delightfully surprised at the emails that I've already been getting. Please be patient with me for the first couple of days in just making sure that the processes are in place so that when we start exchanging information, that it flows smoothly. And as I also mentioned, any question you have regarding employee benefits, feel free to ask. I'm an extension of the Idaho Nonprofit Center.
Awesome, thanks, Dave. Again, to recap, the resources and the FAQs are on our website at idahononprofits.org. And you can navigate there under the membership tab. I'll just show that one more time so before we sign off here. Again, on our homepage, then hover over the membership tab, and then the INC health plan. You'll find kind of your checklist here. Dave is your point of contact as you start that quote gathering process. And then you have FAQs, many of which were covered, and we'll expound on those as we get more questions. So thanks again, everybody, for being with us today. Please reach out. This is a new process for all of us, including our staff here. And obviously, Dave has been through this many, many times before, and he's our expert. But be patient with us as we launch this. There will be some kinks in it, I'm sure, but we're excited to be able to do this for our state's nonprofits and for your employees. And we hope this is a nice value add. So thanks again, and we'll talk soon.
Thank you so much, everybody.